My name is Philip van Harreveld. I'm an equine veterinarian, and I'm currently part of the PSV team at Merck Animal Health. I am originally from Brazil. I went to veterinary school at North Carolina State University, and I did an equine surgery residency at Kansas State University. I also owned and operated an equine hospital and field service facility in Vermont for over 20 years. And today I'm going to talk to you guys a little bit about a recent study on EPM that we actually did at North Carolina State University, where I went to school. EPM it's a neurological disease in horses that is caused by parasites present in the horse's nervous system that can lead to a variety of clinical signs ranging from decreased performance, incoordination, weakness, and eventually horses that end up going down and not being able to get up anymore, especially if they're left untreated. It's characterized by what is sort of known as the 3 A's. It presents with ataxia, asymmetry, and atrophy of the muscles. The study that we did involved 6 adult horses that were healthy, that were neurologically normal, and that they were all negative to EPM. We then measured Diclazuril levels from samples that we obtained from placing an IV and a lumbosacral catheter, and that we could use those catheters to obtain plasma and CSF samples over time to be able to measure these levels of Diclazuril in those horses. The study was designed to determine how quickly after a single or initial oral dose of Diclazuril, MIC levels against that Sarcoidosis neurona, the main causative agent of EPM, would be reached in the CSF. MIC, again, is the lowest concentration at which a medication is effective against an infectious organism. So it's an important number when you're treating disease. And since the parasite that causes EPM does so by affecting nervous system tissue, finding out what levels were in the cerebrospinal fluid was very important information to us. So we knew that the concentration of Diclazuril in the CSF was at steady state throughout therapeutic treatment, right? So that was known information. But we did not know was how quickly this medication got absorbed after that initial or single dose and reached that MIC in the CSF. So this new information can help guide veterinarians in their decision-making when having to start treating an acute case empirically, often before even test results are back. So sometimes these horses will decompensate pretty quick, right? And normally you would test for something, but when these horses are affected by this disease, sometimes you have to start treatment and then get your results back and then continue to manage the case. So we felt that this information would be valuable, especially in those very acute cases.